Neuroimaging circuits in schizophrenia. fMRI can uncover abnormal information processing in brain areas linked to cognitive and emotion by putting a load on brain circuits and thereby perform a type of psychiatric stress test while visualizing the activity of the brain circuits. This can most readily detect the activity of neurons near the surface of the brain, which are mostly pyramidal neurons in the cortex. The activity of these neurons is the first leg of various brain circuits, especially the glutamate neurons acting within feedback loops from the cortex to the striatal complex, with that information relayed to the thalamus via GABA neuron, then back to the cortex again via another glutamate neuron as a cortico-striatothalamo-cortical or CSTC feedback loop. Brain circuits like these are information processing engines that are activated by various tasks or loads placed upon them, and seeing them light up may be literally watching the brain think. Functioning in the brain is topographical. For example, the DLPFC is thought to be most closely linked to cognitive functioning such as problem solving, whereas the VMPFC along with amygdala is thought to be most closely linked to emotional functioning such as mood. Patients with schizophrenia cannot adequately recruit the hippocampus during memory recall. It appears that the prefrontal cortical or hippocampal dysfunction in schizophrenia is more complicated than just hyperactivation or hypoactivation, but might be better characterized as out of tune. Patients with schizophrenia appear to utilize greater prefrontal resources when performing a cognitive task and yet achieve lower accuracy because they have cognitive impairment despite their best efforts. When performing poorly, schizophrenia patients do not appropriately engage and sustain the DLPFC, and this shows hypoactivation. To perform near normal, patients with schizophrenia engage the DLPFC but do so inefficiently, recruiting greater neuronal resources and thus hyperactivating the DLPFC. Thus, the DLPFC circuits in schizophrenia can be either underactive and hyperfunctional or overactive and inefficient. The unaffected siblings of patients with schizophrenia may have the very same inefficient information processing in the DLPFC and might have some mild degree of cognitive impairment, but not enough of the risk genes to have the full syndrome of schizophrenia itself. Schizophrenics has impairments in the ability to identify and accurately interpret emotions from overt sources, including facial expressions. This may be due to inefficient information processing within the VMPFC and amygdala and can be measured by imaging the response of the amygdala to emotional input, especially from facial expressions. Schizophrenics may not activate the amygdala in response to scary, fearful, or emotionally charged faces and thus have lack of emotional processing. It may represent as distortion of reality as well as impairment in recognizing negative emotions by schizophrenics. Failure to mount a normal emotional response to a scary face can also represent an inability to interpret social cues and lead to distortion in judgment. On the other hand, a neutral phase or a neutral stimuli may provoke a patient with schizophrenia. Activating emotional processing in amygdala when it is inappropriate may accompany the symptoms of paranoia and can lead to impaired interpersonal functioning, including problems in social communication.